Hi guys, how you doing? I hope you are doing well and welcome. So today we are doing a continuation. Uh, we will talk about the oral contraceptive method number 2 called the combined um, oral contraceptives. Okay, combined oral contraceptive. Remember in the last session we talked about the progestin only pill. So today I want us to learn about the combined oral contraceptive. Yes, and the most common dispensed here in Kenya is called the microgynon. Okay. Yes. So this is a pill that has two hormones, progestin and estrogen. Yes, both in one pill. And this pill is taken daily to prevent you from getting pregnant. And also it is given in some cases, like when you get those ladies who come back complaining, maybe these ladies who, when they use the implants, that method that lasts for 5 years, and also there's another one for 3 years. Some, when they use that method, they have maybe heavy menses, or some spotting that is often, that is so annoying. So these combined pills are given to them so that they can regulate the hormones so that they just don't that spotting regularly. So but today we will learn on how it prevents pregnancy. So it is a pill that is taken daily at the same time, okay, to prevent pregnancy. Okay, so if you decide that you'll be taking it at 8, it should remain at the same time every day, and you should not exceed 3 hours past the routine time that you take your pill every day. So it works by inhibiting the ovulation. So that means the ovary is not going to release an ova, so no fertilization will take place. Number 2, it thickens the cervical mucus, so in such a way that the sperm cannot penetrate. So it won't swim freely, so it won't meet the ova, and there will be no fertilization that will take place. Okay. This pills comes in a pack of 28. You will have to take 21 pills in 21 consecutive days, and then there are 7 pills that are non-hormonal. So you will decide whether you will take them or not, but your gynecologist, your nurse will explain to you. You will be shown which ones are the hormonal pills, which ones are not. So you will take 21 pills for 21 consecutive days, and then you will rest for 7 days. Once you complete the 7 days, you will open another pack and start taking the hormonal pills immediately. Okay, or you will take 21 hormonal pills, you will continue with the 7 pills that are non-hormonal. When you finish, open another pack and start taking them immediately. So you will discuss that with your gynecologist or nurse, and you will decide how you will go about it. Okay, what are the benefits? Number 1, it is a reliable method. This means if you take the pills like correctly, if you take them correctly, it is a 99% effective. Okay, you are almost assured that you will not get pregnant. Number 2, it does not interrupt sex. No way at all. Just take a pill and enjoy your sex. Number 3, for those ladies who experience heavy menses, painful menstruation, irregular periods, this pill will sort you out. Why? You will have regular periods, you will have light menses, and also less pain during menstruation. Okay, that is an advantage or a benefit. Okay, disadvantages. Number 1, it doesn't protect you from sexually transmitted diseases. Only condoms will. Any other method, it won't protect you. Number 2, there's a slight risk of developing a blood clot called a deep vein thrombus. Okay, there's a risk, so that's why you are advised that before you start using this method, ensure you don't have blood clot. Okay, or if you have ever had a history of this blood clot, do not use this method. It's not recommended for you. Okay, so before taking the combined oral contraceptive pill, make sure your blood pressure is checked and it is within the accepted range. Okay, number 2, make sure you check for pregnancy. Do not just start using any method of family planning before doing a pregnancy test. Why? Once you just starting taking pills before checking, and by bad luck or by a chance you find that you are pregnant, high chances that you will get an abnormal baby. And I know there's no mother or there's no lady who will want to get an abnormal baby. So to be on a safe side, just make sure you do a pregnancy test. Ensure you are not pregnant before you start using any method of family planning. Okay, while using this method, you will be required to do regular checkups in the hospital to check your blood pressure, to check to do pap smears. You know what is a pap smear? It is a test that is done to check for cervical cancers. So you will be required to check your blood pressure. You will be required to do pap smears. That is a test to check for cancer, cervical cancer. And also you will be required to do a breast exam to check for any breast lumps. This one, the breast lump, your nurse will help you know how you can do it from home, so that you can notice any abnormal lumps in the breast, so that you can consult early. Okay, so do not use these pills if you have a blood clot, you have a disease called DVT, or if you have ever been treated for DVT. Do not use these pills. If you are scheduled for an operation that is going to make you lie in bed for long, or if you are bedridden, that means you are restrained in bed. You okay, not exactly restrained, but if you are bedridden, do not use this pill. If you have ever had a history of getting a stroke or a heart attack, do not. If you have a breast cancer, do not use. If you have liver disease, liver tumors, if you have any issue with your liver, any issue with your heart, okay, any issues with your breasts, do not use this method, okay, because it will worsen the situation. So what are some of the side effects? The side effects, they are not harmful, okay, but you can learn how you will control the side effects. It's only that they are annoying, but it's not harmful. Number one, we have nausea, we have weight gain, we have headaches, we have mood swings or low moods. Yani unakuwa tu na makasiriko for no good reason. Okay, and the last one, we have breast tenderness or pain in your breasts. These are just the side effects. They are harmful. They are harmless. They are not harmful at all. It's only that they are annoying. If you can be able to control them, good for you. So, a point to note: if you miss to take a pill, if you forget to take a pill as soon as you remember, even if it means taking two. Just take the one that you missed. And then it's not recommended for breastfeeding women because of the estrogen in it, okay? It's not recommended for breastfeeding women. Yes. So I have told you that there is a risk of developing a blood clot. How will you know that you are developing a blood clot? If you notice that one of your legs starts swelling, okay, your leg just starts swelling, it becomes painful when standing or when walking, and then it feels warm by touch. These three symptoms: number one, it just starts swelling, it becomes painful when you are walking or when you are standing, and then it feels warm by touch. Rush to the hospital and let your doctor examine you. More serious signs that you might be having pulmonary emboli. This means you have a clot in your lungs. You start having difficulties in breathing, and then you have a cough, okay, without an obvious cause. You just develop a cough, and then you cough up blood. You cough up blood, okay. You start having difficulties in breathing, you cough up blood, and you start getting dizzy. This means that you might be having a pulmonary emboli. This is a very serious condition or a life-threatening condition. Just rush to the hospital so that your doctor will advise you on what to do. Okay. And a piece of advice: when you want to initiate this method of family planning, it's best when you start it on your day one of menstruation. Okay? Start on your day one of menstruation, or start between day 1 to day 5 of your menstruation. Just start it when you are menstruating. Okay? If you do that, protection from getting pregnancy just starts immediately. You start using it when you are menstruating. But if you use it any other time apart from the time you are menstruating, you will be required to use an alternative method of family planning for 7 days so that you allow this method to start working. Okay, you can use a condom, you can use withdrawal method, whichever method you want to use, you will know. But it should be for 7 days, okay? So that you give it time to start working. But if you use it, you start it when you are menstruating, between day 1 to day 5. It will start protecting you immediately, okay? Yes. So, do you have any question? Just ask me in the comment section. I will try to answer you. Do you have any topic that you want me to discuss? Just tell me in the comment section. I will consider doing that. And then do not forget to subscribe. Thank you so much for those who have subscribed. Thank you. Our channel is growing and I'm so grateful. So please just support it by subscribing, share, comment, like, do any of those ones, and I will really appreciate. Thank you so much for watching.